For over 20 years, the Caribbean MedLabs Foundation, regional governments, and development organizations have been working together to increase laboratory regulation in the region. We have come a long way, and we still have further to go. Today, less than 10% of Caribbean labs are regulated. What does this mean? OECS governments are coming together to mobilize community support for lab regulation. Let us unite Caribbean communities to trust every result.
Greetings from the Caribbean MedLabs Foundation. For nearly 20 years, the Caribbean MedLabs Foundation, regional governments, and development organizations have been working together to increase medical and public health laboratory regulation in the region. We congratulate every Ministry of Health and government for their support to date for this effort, including their support for training and implementation of quality systems in their laboratories. We have collectively made significant progress, but much more has to be achieved to ensure that we can trust every result. Today, less than 10% of Caribbean laboratories are regulated, making laboratory regulation a pressing need in our region, a need that affects the health and well-being of every person living in and visiting the Caribbean. This need became even more evident during the COVID pandemic as the critical importance of laboratories to addressing public health threats and to ensuring readiness for future pandemics was clearly illustrated. Today, we are very pleased to be launching a Trust Every Result campaign as a call to action to ensure that every laboratory result, whether from a clinical or public health laboratory, can be trusted. This campaign aims to address the pressing need for structured regulation and control of Caribbean medical laboratories at both the national and regional levels, and it's designed to mobilize widespread support for laboratory regulation throughout the region. In fact, do you know if the laboratory that provides your medical results is regulated and required to meet basic standards? We are very pleased that Dr. the Honorable Ralph Gonsalves, Prime Minister of St. Vincent and the Grenadines, has kindly consented to champion the cause of laboratory regulation across the Caribbean. And the campaign has the support of ministries of health throughout the OECS, as evidenced by statements provided by the Honorable Minister of Health of Grenada and permanent secretaries and chief medical officers from several of the OECS countries. The Director General of the OECS is participating in this launch in recognition of the importance of this initiative, which is being implemented under the OECS Regional Health Project funded by the World Bank. For those of you who know us at CMLF, you would recognize that this has been our life's work. Unfortunately, Mrs. Wendy Kitson-Piggott is not able to be here with us today. However, she has sent her message to emphasize that governments, laboratory staff, and users of laboratory services need to be so much more aware of how essential, standardized, and regulated lab services are to the timeliness and actuality of patient recovery and wellness, to protecting us all from the impact of dangerous diseases, and to reducing the very, very high cost of healthcare service delivery. As healthcare providers at the policy level or within the lab, we need to be ever cognizant that we must make every effort by implementing standards and being regulated to do no harm. We look forward to your support as we escalate this effort to ensure laboratories in all our countries are regulated so that we can all trust every result. Thank you.
The Caribbean MedLabs Foundation, CMLF, has been engaged in a consultancy under the OECS World Bank Regional Health Project to support the implementation of national laboratory policies and legislation that underpin laboratory standards implementation in 4 OECS project countries. Lab policies and legislation will, we expect, positively impact the quality of healthcare provided within project countries as well as within the wider OECS and Caribbean region. CMLF has coordinated the development of a campaign to trust every result provided by medical and public health laboratories in the OECS, which the Prime Minister of St. Vincent and the Grenadines, the Honorable Dr. Ralph Gonsalves, has kindly consented to champion. The global context. It is important to place this initiative in both a global and a Caribbean context. Governments worldwide are increasingly regulating medical and public health laboratories to safeguard their populations from harmful lab practices. Over the past decade, lab services around the world have been undergoing significant reform and transformation. It is imperative that governments take the lead in introducing standards and laws to regulate medical and public health labs comprehensively. Despite the drafting and introduction of lab policies and laws and regulations to CARICOM countries over 7 years ago, approval and implementation have yet to occur. The pace of transformation in the Caribbean must accelerate, given the escalating frequency of natural disasters and the growing threat of epidemics. Our objective should be to establish laboratory regulation as the standard in the Caribbean, ensuring the trustworthiness of every test result. In 2022, the St. Vincent and the Grenadines government took a pioneering role in the OECS laboratory transformation by introducing the National Laboratory Policy and enacting legislation to regulate medical labs. These measures aim to enhance pandemic response, protect the population, and reduce healthcare costs. An urgent plea exists for other Caribbean heads of government to prioritize the highest level of healthcare for their citizens. It is estimated that over 80% of clinical decisions hinge on lab results. Only governments can guarantee that their populations consistently receive accurate lab results, guiding treatment decisions and curbing national healthcare expenses. Pandemics have a potential to cripple a country's healthcare system and devastate national economies, as we've seen with COVID. They've also severely impacted the region's tourism industry. The early identification of dangerous disease outbreaks depends on timely and accurate lab results. Only governments can prevent the collapse of the lab sector when confronted with the pressure of devastating pandemics and epidemics by establishing policies, guidelines, structures, laws, and resources for readiness. Non-communicable diseases pose a significant public health threat and contribute to healthcare inflation, consuming substantial national resources. Lab data and information are indispensable in NCD prevention, in control effects and cost reduction. Implementing laws to ensure reliable and accurate tests and the management of public health threats is essential. Regulated labs safeguard the Caribbean tourism industry and they enhance the sustainability of national health insurance programs. In the current global climate, global health security is a paramount concern, necessitating again the regulation of lab services to protect national, regional, and global health security. The presence of both anecdotal and concrete evidence of medico-legal issues, including the impact of lab errors, is a global reality that underscores the urgent need for lab regulation. Inaccurate lab information can have detrimental consequences on individuals' lives and expose governments to legal liabilities.
Hello, I'm Jonathan Macret, Minister with responsibility for health, wellness, and religious affairs in Grenada. As a policymaker, I understand the importance of policy as it relates to having consistency, having efficiency, having accountability, and the setting of clear guidelines so that there is operational unison across the sector as it relates to laboratory functions. In that regard, as a health sector and from a whole of government approach, we are vehemently advocating and championing the cause for laboratory regulations so that we can deliver better healthcare services to our people and ensure the health and safety of our clinical staff and also the citizens of Grenada, Carriacou, and Petite Martinique who patronize our laboratory services. Won't you come on board? Time demands it.
As Prime Minister of St. Vincent and the Grenadines, I'm offering myself as a champion for the legislation to regulate medical laboratories. It is very important that we have this done, both for the public sector and the private sector. It is well known that unregulated laboratories cause a lot of problems. Look, 80% of the diagnoses which are done on the basis of what comes out of medical laboratories, the tests. And if you get that wrong, you can have the diagnosis wrong. So we need to have the proper control mechanisms. We need to have proper regulatory oversight. We have to ensure that every dimension of medical laboratories be of a top quality to provide efficacious results for the medical practitioners and other professionals in the health field. St. Vincent and the Grenadines has taken a lead in this regard, and I'm encouraging all throughout the CARICOM and elsewhere to have proper legislation regulating medical laboratories and to promote transparency, efficiency, and best practices in this important field of medical and health work. I'm a champion for this cause. Let's get on with it. Thank you.
Your support matters. Join the OECS and Caribbean Med Labs Foundation on this movement to regulate Caribbean labs. Sign the petition at www.trusteveryresult.com. Together, let's regulate Caribbean labs.